Janice MacKinnon is an Executive Fellow at the University of Calgary School of Public Policy and Professor of Fiscal Policy at the University of Saskatchewan. Between 1991 and 2001, Janice was Cabinet Minister in Roy Romanow's NDP government in Saskatchewan and held various portfolios, including the Minister of Finance. During her tenure as Minister of Finance, the province of Saskatchewan came dangerously close to defaulting on its debt payments. And we're not attributing the cause of all that to Dr. MacKinnon, but with the help from the federal government and following significant spending reforms in that province, Dr. MacKinnon and the Saskatchewan government became the first government in Canada to balance its budget in the 1990s. This past year, Jason Kenney's UPC government in Alberta commissioned Janice to be the chair of the MacKinnon Panel on Alberta's finances that recommended ways to eliminate waste, duplication, and non-essential spending to fund government's key priorities while ensuring high-quality frontline services for Albertans. That's worth repeating, that the exercise that she went through was eliminate waste, duplication, non-essential spending to fund government's key priorities while ensuring high-quality frontline services to Alberta. This is exactly what we want and need here in Newfoundland and Labrador. This is Dr. MacKinnon's, as I've said, the second time speaking to the Employers' Council. In 2018, we invited her to share her experiences with our CEO group, Minister of Finance Tom Osborne, the PC caucus, the NDP caucus, and organised labour. The Board of Employers' Council believes that more people in our province need to hear her story, her experiences, and the results, and we are very thankful that she's able to join us again today. Please welcome Dr. MacKinnon.
Good morning. It's lovely to be back in Newfoundland, and lovely that there wasn't a snowstorm. I actually checked the weather before I came. All of us have memories of events in our lives that they won't forget. And one of mine is being a finance minister and facing the prospect of how you take your province into bankruptcy. Saskatchewan was at the point that the province faced the prospect of bankruptcy. And if you've ever gone through that, you sort of almost have a mission in life when you see other jurisdictions veering in that direction to come and at least share your experiences. How did we get there? How did we get out of it? What did we learn? What could we have done better or differently if we had more time? So that's what I want to talk to you about today. What did we go through in Saskatchewan very briefly, but where are you in Newfoundland? How close are you to the crisis? And what can you do to prevent your finance minister someday looking at the prospect of the province going into bankruptcy? Very briefly, if you look at the situation in Saskatchewan in the 1990s, a 1992 financial report put it well. The Canadian fiscal situation ranges from painful in Quebec to ghastly in Ontario to terrifying in Saskatchewan. What do they mean by terrifying? We had the highest provincial debt per capita in Canada. We had mega projects that had been signed by the government to benefit the companies with the taxpayers on the hook for the risk that couldn't be sustained. Our credit rating was in the B category, which meant that municipalities couldn't even buy provincial bonds because they were regarded as junk bonds. We had gone from a point in which there were 150 potential lenders to the province to 25. Our credit rating had been downgraded, and at one point we tried to borrow money and couldn't. There's the point in which you are in a crisis and you've lost control over your decision making. Because what happened is the credit rating agencies said, this is the level of deficit we will tolerate this year, this is the level next year. If you don't meet that, you will not be able to borrow money. So crisis is when you've lost control over your decision making. can be to credit rating agencies, or if anybody wants the federal government in here, they would be forced to do the same thing. Here is what you have to do, and you have a very short time frame to do it in. Now, how did we get there? Well, probably how you got where you are. Government overspending, government not adapting to changed circumstances, government trying to be all things to all people, and government delay. We'll put this off. Boot it down into the future. Surely something will happen to save us. So what happens when you're in a crisis? You have a very short period of time to make decisions. Ours was 2 years. And the only choices are dramatic cuts and dramatic tax increases. So some of the things we did were the right things, and you can learn from that. But my main message to you today is if we had acted, it wasn't our government, it was another government, so we actually did not take any of the blame for it. If the government had acted sooner rather than dramatic cuts and dramatic tax increases, they would have had the luxury of time to actually restructure programs and focus on economic growth more than just boom. So where are you today in Newfoundland? You're traveling down the road that Saskatchewan was on a couple years before I became finance minister. You have the highest per capita debt in Canada. Your Auditor General said it's about $15.4 billion, which is almost $30,000 per person. Over the last 10 years, your government spending has increased by 30% when your revenues have shrunk by 10%. So this is delay. Revenue's going down, but we're just going to continue to keep spending, and we're not going to be giving people the bad news that change is required. There's an aging population, which means more costs for programs like healthcare, and there's out-migration, particularly of young people. The government has said it's got a plan to balance the budget by 2022, 2023. But again, the Auditor General has pointed out that to do that, you have to cut spending by 7%, and that doesn't take account of inflation or the natural increase in public sector salaries. Even if the wages don't go up, they move up the ranks. So there's no details here. There isn't a balanced budget plan with targets and specific measures. It's aspirational, and for credit rating agencies, aspirational doesn't mean anything but a wish and a hope. So, where are you? You're at a very serious turning point, because with the level of debt, until the budget is balanced, you are in the vicious cycle, and you're moving, depends on circumstances, how quickly you're moving to Saskatchewan's crisis. With a sizable debt, running deficits every year, more and more money is going to interest. So next year, you will need more money to provide the same level of services, because more of it will go to interest, which means a bigger deficit. But a bigger deficit means more debt, which means higher levels of interest. So the year after that, you will need even more money to stay where you are, and a higher deficit, more debt, higher interest. It's a downward cycle, and until the budget's balanced, it's just, the question is the speed in which you go down. There are a couple of risks to the slow downward cycle. One is interest rate increases, probably not as great a risk as slowdown in the economy. The virus, trade wars, the blockades, the lack of federal leadership on economic development. It's not, Canada's reputation as a place to invest is not going up in the world. So there are economic risks that could speed up that downward cycle. So what do you do to prevent getting into the cycle of crisis in which you have to make decisions so quickly that some of them are good, but some of them you wouldn't have made if you had more time? The province has to align its spending with its revenue. So it's a spending problem. It's not a revenue problem. And it has to do that, and it has to use the time to restructure programs and deliver them in a way that is more affordable and deliver them in a way that is strategic. And it has to grow the economy. Without economic growth, young people will continue to leave, and you need the revenue from economic growth to pay for the programs required by an aging population. So what's the way back? The biggest hurdle in dealing with a situation like this is denial. People will do everything to avoid facing the problem. Well, you know, it's really only temporary. I saw there was a conference here. People said, well, increase property taxes. You go, if you only increase some taxes, if you only waited for the oil to come back, if in our government there were a certain number of farmers, well, farmers can get their debt written down. Why can't somebody write down our debt? The first step is for everybody, particularly the government leadership is critical, to say we have a problem. And the sooner we deal with it, the better off we're going to be. The second part of the way back, communication. People understand, basically from their own household circumstances, that like themselves, the government can't each and every year spend more than it's taking in. Eventually, somebody, the equivalent of the credit card companies, will catch up with them. So communication is key, talking about the basics of the problem, and talking about the fact that it's only going to get worse. I know in our province, one of the things that rallied people was talking about future generations. You're kicking this problem down the road. It's going to get worse. And I don't know what that is. It's going to get worse. And do you really want to leave this problem bad today, worse tomorrow, to your children and grandchildren? Another part of the solution is strategic government. What should government be doing? What are the strategic services and programs that government has to provide? What are the other programs that, yes, they're nice, but they're not essential? And you have to change people's expectations of what government can provide. I went through that myself when I was a minister, because my first ministry was Minister of Social Services. And my job, it was just after the election, my job was to implement the election platform. And the election platform in social services said we were going to eliminate food banks. So we have no money. We're facing a terrible fiscal situation, and we're going to eliminate food banks. I had a very good, experienced deputy minister, and he said, well, the only thing you can do is you've got to go around the province and talk to people about our situation and about why eliminating food banks is not something that we can do. So I wanted to get the message out and traveled the province, and I did get the message out, but more dramatically than I really probably wanted. Because I remember I was out of the province at a meeting, and the Premier phoned, and he said, you're the headline story in the newspapers today. I said, oh? He said, nice picture. Terrible story. Food banks are here to stay. And I said, well, I think it's true. And he said, you're the Minister of Social Services. You have to give people hope. I said, well, but if it's false hope, they're going to find out. So anyway, we agreed to disagree. But when the budget came out, it wasn't the first budget, wasn't mine. and people were appalled at the cuts. The only group that was sort of understanding were the people in social services. They said, well, you know, we don't like the fact that we're not getting any more money, but we understand. And I think probably I got the finance minister's job because of that experience. You have to talk to people and transform their ideas about what governments can do. And I'll refer to it briefly in a moment. There are lots of things in Newfoundland, if you look at the situation, that the government should be telling people, we can't continue to do this. The two other things that you need to do is the government, particularly, has to figure out things they can fix and things that are beyond their control, particularly in a global economy. So the previous government in Saskatchewan spent huge amounts of money trying to fix the family farm, to sustain family farms. Well, it was a global phenomenon. And the demand for agriculture products are global, the input prices are global. You couldn't fix it. So be hard-headed enough to say, that's a problem, but the solution is beyond our control. The final thing is the Premier was right. People do need hope, but not in the way he meant. I thought his hope was false hope. Don't worry, be happy. And the only way to get to hope is to restore fiscal discipline to the government, to come out with a plan, 4 or 5 year plan, to balance the budget, not just throwing out, well, by this time we'll balance the budget, with specific targets that have to be met, with some specific ideas of how you're going to get there, and then the vision of what happens when you get there and you've balanced the budget. Because once you balance the budget, you go from the vicious cycle to the virtuous cycle. You've got a surplus. So every year you're paying less in interest. And the less you pay in interest, the more you can use for tax reduction or program spending. And your economy begins to grow because business has confidence that this is a stable place to invest. And so you have a future that's optimistic and going up in a spiral as opposed to down in a spiral. So the plan to balance the budget is not just something for credit raters. It's something to give business confidence and to give voters hope. Now, when you look at your situation today, not being in the crisis, but moving well along that road, there's an argument that I think is really problematic. There's kind of a polarized argument. All you can do is one of two things: austerity, which means dramatic cuts, or doing nothing, or just kind of playing around the edges of a little cutting here or there, but not really facing the problem. That's a false dichotomy. Doing nothing or just cutting around the edges and not really getting at the problem is the path to austerity and draconian cuts. The middle way is to take advantage of the fact that you have some time here and to prioritize programs and services, deliver them more effectively, and put in place policies to promote growth in the economy. So, looking at the restructuring programs, what kinds of things have worked? When I did the review, there was a panel of us in Alberta. What we did is we reviewed all government services and programs and reviewed them comparing them to comparable provinces. For Alberta, it was the 3 other big provinces. We got KPMG to do much of the work. So your comparable would be Atlantic Canada. What's your spending like in this area? What are your outcomes like in this area? And you'll find in many cases you're spending more and outcomes are not better. And what are other provinces doing? What's the best policies out there? What's working elsewhere to enable comparable provinces to deliver better services at a lower cost. And again, going back to strategic government, what services and programs are not fundamental and can be eliminated or delivered differently. One of them, just yesterday, Newfoundland is one of 2 provinces that provides the most generous benefits for Canadians traveling abroad for healthcare. Why are you doing that? Why would that be something that Newfoundland should be doing? Which brings me to one of the areas that you have to deal with. Any province that wants to balance its budget has to deal with healthcare. It's the biggest expenditure, or over 40% of your budget is spent on healthcare. If you can't control spending on healthcare, it's really almost impossible to balance the budget. There are just a couple of numbers in healthcare that I think tell the story on Newfoundland. This is high spending adjusted for demographics, adjusting for the fact that you have an older population. The average spending per person in Canada on healthcare is $4,360 a year. The average spending in Newfoundland is $5,577 per year. So you're spending per person over $1,000 more than the rest of Canada. You're spending more. Are the results better? Mortality rates, life expectancy is lower than the Canadian average. Obesity is higher. Smoking is higher. And it goes across the piece. You're spending more, but your results are not better, and in some cases, worse. So what you need to do is to look at what's happening in other provinces that are spending less but getting better results. There are several of them. BC and Ontario are probably the best. And again, it doesn't take a lot of time to look at what some of the problems are here. There are 2 big cost drivers in healthcare: hospitals and doctors. Newfoundland and Labrador spend more per capita on hospitals than virtually any other province in Canada. And they use hospitals more than other provinces. Just to give you a rough idea of what I'm talking about, to keep a person in a hospital for a day is, depending on the hospital in the province, $800 to $1,000 a day. Long-term care, maybe $600. Home care, $200. So you're using the most expensive way to treat people. Forget how many hospitals you have, 31 acute care hospitals in a province like this. And it's not where people should be. Only people with acute care conditions should be in hospitals. People with Alzheimer's, chronic conditions are better off in other facilities. And hospitals are dangerous places to be. I try to avoid them. There are infections there that can severely damage your health and kill you. So, first of all, one of the things that has to happen is that people need to be moved from acute care hospitals to more long-term care, more home care, or more specialized facilities. I would even take that further. In Saskatchewan, not our government, but the subsequent government, the Wall government, took 34 day procedures that were performed in hospitals and moved them out to private clinics. They tendered the contracts. Alberta company won the tender, was totally regulated, the same as in a hospital, and paid for by the government. The 34 procedures were 26% cheaper to deliver in a clinic than in a hospital. And if you need a procedure, you're better off to go to a clinic than a hospital, because the clinics All they do is knees, 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 knees. They're experts, as opposed to a doctor that occasionally does a knee procedure. People in the province initially thought this was terrible. But as they had occasion to use the clinics, they actually became popular. You didn't have to go to the hospital. You didn't have to go through all of the bureaucratic procedure, the risks of being in the hospital, the infections. You pulled up to the clinic, you were in there, you were out of there. And the government's saved 26%. The other change is doctors. The most expensive way to treat patients is by using doctors. But if you look at what other provinces are doing, they rely less on doctors just for really acute problems. But nurse practitioners, highly trained nurses, are used for many other procedures. In Ontario, nurse practitioners have their own clinics and run their own clinics. And the cost of a nurse practitioner is less than half of the cost of getting a procedure done by doctors. Same with registered nurses. Registered nurses are the most expensive nurses to use. They are required for some sorts of procedures, but there are many of their tasks that could be done by licensed practical nurses. So these are the kinds of changes that have to be made to the healthcare system to bring that number down so that you're closer to the national average. Before I leave that topic, what I said there sounds easy, but you will get a fight from the practitioners as you make these changes. It's occurring now in Alberta. So first thing to do, and I've taken healthcare as an example, do it across the piece. Look at other comparable provinces, figure out where you're spending more, getting poor, look at the results. Are you spending more, getting better results? Fair enough. Most of the time, spending more, not getting better results. And what are best practices? What are other provinces doing that are getting better results for less funding? The second part of it is to promote economic growth. What we had to do in our government is shift from mega project funding. Saskatchewan was like, I think Newfoundland too is the same history. The politics of, ribbon cutting for a new facility are great. My gosh, look at this. We're building this project, this mega project. But often what happens is you're picking winners and losers. First of all, we're going to fund this project as opposed to this other one. And what happens often is the government's left with the risk. And if the project falters, it's taxpayers that are on the hook. What we shifted to is to ask the question, what does business need to invest in Newfoundland? Because Newfoundland needs more investment from outsiders, but people here need to be encouraged to invest further in the province. Pedro mentioned this, the tax rate. For sure, you should look at the tax system. Personal income taxes here are high, business taxes are high. The province has a payroll tax. The payroll tax is a disincentive to hire people. Every person you hire, it costs you more. Payroll tax is not related to profitability. So getting the tax regime right. Looking at the regulations. Yeah, you need regulations, but do you have overburdening regulations? Can you streamline your regulations to make it easier for business to do business here? And then the infrastructure, the educated workforce, all of these things. So what I would really encourage the government to do, as well as restructuring programs, is to get a real economic development plan, which is there, visible to the public, and says to business, this is a good, stable, and attractive place to invest. My final comment is what the government and the people of Newfoundland and Labrador shouldn't do, and that is think that the federal government will bail them out in some way. They've made attractive arrangements with respect to Muskrat Falls and the Atlantic Accord, but they're specific to Newfoundland, and even there's criticism developing. There's a very good article in the Globe and Mail, and you hear it elsewhere. Muskrat Falls, yes, the federal government was involved, but Newfoundland governments made bad decisions, and they should be bearing the consequences of it. When you're saying the government of Canada should bail out Newfoundland in any way, you're saying that taxpayers in other parts of Canada should do that. And why would the government of Ontario think that their money, or the taxpayers of Ontario think that their money should bail out Newfoundland when Newfoundland has lower tuition rates than Ontario? Newfoundland is a big spender. It's got to get its spending under control by itself. And even if the current government decided in some way to give Newfoundland a break, the premiers of other provinces would not let that happen. And one thing that is happening in Canada right now, which I actually welcome, is the strength of the premiers, their willingness to stand up and say, you know, we are not prepared to let this occur in Canada. So I would not rely on the federal government. If the province went into bankruptcy, the federal government would have to step in, but the terms would be the same as the credit rating agencies. The other provinces would say, we're not giving them a break. They have to meet these deficit targets. So, in conclusion, you're in a serious situation. Without a change in policy, it will be a downward spiral. The question is how fast. It's really important for the government to take advantage of this period of time before they're in that crisis to get a plan in place, a credible plan that's credible to credit rating agencies, but also to business and taxpayers in the province, to restructure programs, to look at strategic spending, and to develop a plan to grow the economy. And then you'll come out at the end of it, yes, with some difficult choices, but with a better future. Thanks very much.